Good afternoon, everyone. So I hope you all had a chance to enjoy the panel keynotes from this morning, and perhaps you've checked out some of our special interest groups. And now welcome to our breakout session. So my name is Gloria, and I serve as the Director of Clinical Research at the Osher Center, and also the director of the Harvard Medical School Research Fellowship in Integrative Medicine. So following the overarching theme of our network forum this year on education in integrative medicine, we thought it appropriate to bring you some perspectives of our integrative medicine research trainees. Next slide. Okay, so to provide some context of our fellow panelists, each of the panelists are postdoctoral trainees in our T32 Research Fellowship in Integrative Medicine. So this is a 3-year fellowship that's open to those with a range of postdoctoral degrees and backgrounds that prepare the trainee for an academic career in research of integrative medicine. And as a path to an independent research career, many of our fellows go on to obtain K Career Development Awards through the NIH. So we have 6 fellows that will speak briefly today. Doctors Jacklyn Foley, Denis Muñoz-Vergara, Ivy Ma, Michael Datko, Kristen Kraemer, and Amy Yang. And as you'll see, each of our fellows has a unique background and a unique journey in this field. So they will each introduce themselves, but among them are clinical psychologists, neuroscientists, a physician, someone trained in veterinary medicine, and also those trained in acupuncture and traditional Chinese medicine. So I hope that this session will highlight, some of this very rich diversity while illustrating that there are many paths to success. So what I've asked each of the fellows to do is introduce themselves and their background, and then share a challenge or two that they've faced in their journey, really recognizing that succeeding in academic medicine, and particularly in the field of integrative medicine, is not always easy. And they'll offer some lessons learned and perhaps share some pearls of wisdom. So some of these challenges may be generic, others may be more unique to their respective journeys, but we hope that hearing their experiences might resonate with some of you in our audience, and the lessons learned might be informative. Also in doing this, I hope that some of our 3 main forum themes will be illustrated. The 2 themes from this morning, keynotes of stress and resiliency, and interprofessional education and communication, as well as the 3rd theme of diversity, equity, inclusion, which the keynote session will highlight later this afternoon. So for the structure of today's session, we will go through each of our 6 fellow vignettes in series, and then I'll be moderating a panel discussion for the remaining 15 minutes or so at the end, posing questions to our panelists. So you can feel free to send in questions for one or more of the panelists through the QA bar at the right, and we'll do our best to incorporate it in the discussion at the end. All right then, next.
All right, hello everyone. So my name is Jacklyn Foley, and I'm one of the 1st-year fellows in the Integrative Medicine T32 training program. We can go to the next slide. Awesome, thank you. So just to give you a little brief background about me, I received my doctorate in clinical psychology this past summer. My training has always had an emphasis in behavioral medicine, or understanding the behavioral components to really medical care. My research focus has been primarily in understanding psychological and behavioral factors as it relates specifically to HIV care and prevention. And so this can include things like depression and substance use with respect to psychological factors, and also things such as medication non-adherence and physical activity, among several others, with respect to behavioral factors that are critical to maintaining HIV related health outcomes. And really, in a lot of my work, I'm trying to understand how these associations have come to be. So, for example, how is depression related to medication adherence with respect to underlying causal mechanisms, really to identify and target points for intervention? So, for example, one of my current projects is evaluating the association between dispositional mindfulness with psychological and cardiovascular health among people living with HIV to measure the possible benefit of mindfulness that might warrant further investigation in an RCT. So always kind of coming back to the idea of intervention development. And so what I thought I would do today is leverage my experience in both integrative and behavioral medicine that requires a high degree of interdisciplinary work, collaboration, and education, and my work as a clinician to discuss both how best to communicate research and how you prioritize your own mental health and foster resiliency. Next slide. So we'll start in thinking about interdisciplinary education with a focus on how do you communicate your research ideas to different professionals. So for example, in my world, that often includes medical doctors, as well as other psychologists, biostatisticians, and often many others, in a clear and cohesive way. And the first strategy is really to put yourself in the role of a novice listener or reader. I often sometimes try to put myself back in my first year graduate shoes and first deciding that I wanted to research behavioral kind of characteristics of HIV treatment and thinking, what questions did I have back then? What did I need explained to me? And where was I really going in terms of research to answer those questions for myself? Sometimes that can be hard though. And so oftentimes you also have to consider, what is the experience like for me when I'm the person in the audience? What do I feel like I need to know in order to understand someone's work that they're presenting to me? Another strategy I often use is to identify possible questions. So, if I was a person sitting in that audience, what questions might I have? And I often will think about all the different types of questions like how does this work? Why is this important? What exactly is it you're going to do? And so forth. And that I think it helps me to make sure I'm creating a really clear picture. Another strategy is maybe obvious, but worth stating, which is to break things down into the simplest or most basic pieces of information. And sometimes that means taking that kind of 10,000 foot view. When we're very passionate about our work, can get really into the nitty-gritty details that often can be challenging for other people to follow. So I often have to remind myself, 10,000 picture view or my elevator pitch mode. What are the critical pieces that I want to get across, and what's the simplest way I can get someone to see my point of view? Another almost obvious one, but definitely worth mentioning, is reiterating the most significant points. I always ask myself, if they walk away with one thing or maybe one or two things, what is it that I really need them to hear and walk away with? And finally, consult and ask for feedback. I often meet with people and ask for their input, especially when they work in a field outside of psychology, since that's where my training is. And I will get different feedback from the different people that I ask, and that's very, very helpful. Like they'll get kind of stuck on a point or not understand a point of my work, and I'm like, that's super useful to know. When I discuss this with other psychologists, that I never get asked questions like that, and it's always very helpful. So always consult, always ask for feedback. And the other challenge I wanted to bring up is more leveraging my work as a clinician and thinking about how you foster resiliency with respect to how do you prioritize your own mental health and self-care, particularly for me when working with highly stigmatized populations. So as mentioned, a lot of my research and much of my clinical work as well has focused on working with people living with HIV. And if that is not your area of expertise, you may or may not be aware that HIV disproportionately affects marginalized populations, whether that's people of color, people of lower socioeconomic status, people that identify as a sexual or gender minority, and so on and so on and so on. And what that means is you're often working with populations that have a lot of systematic and systemic issues in working with such populations. And it can sometimes feel daunting to try to help people navigate those systems, be advocates for themselves, all while trying, to work on things like depression and anxiety and so forth. And so where I found has been helpful is to be mindfully aware of how, have that awareness of how that affects me in a day-to-day way. What am I taking out of sessions when I'm working with people, and how is that altering me? What thoughts, what feelings am I having? Always coming down to practicing self-compassion. I think we can be really hard on ourselves, feeling like maybe we're not making meaningful change in people's lives, but really holding that and acknowledging that this is really challenging work, and we deserve and need support and empathy around that. Ask for support always. Focus on progress and change. Sometimes these things can feel small, but they're not. They're making really big changes in people's life. And finally, capitalize on frustration. I often tell people negative emotions, although hard to sit with and maybe uncomfortable to sit with, have a function in your life. And oftentimes frustration can really motivate us to want to stand up and fight for what's important. And that's a good thing. And so capitalize on that frustration. Don't run away from it. Thanks so much.
Okay. Hi, everyone. My name is Denis Muñoz-Vergara, and I'm one of the third-year fellow in integrative medicine. Okay, so first, I will tell you a little bit about me in order to create context around my work. I was born in the Atacama Desert in the north of Chile. My people are called the Canantayo-Kunsa people, and we have a very rich tradition of contemplative practices. I studied to become a veterinary doctor and an animal pathologist. That's my PhD. And since then, I've been working in animal models and basic science. Also, during my time studying veterinary medicine, I encountered the tradition of yoga, and I have practiced that for more than 20 years so far. Yeah. Next, please. I recently had the opportunity to bring my many interests together to study the science underlying mind-body techniques, and in my case, particularly yoga stretching and inflammation. So these are my projects that I'm working right now. Last year, I translated, for instance, an active stretching paradigm from rats to pigs, and the results were published this past May. We also evaluated the stressful component of active stretching in mice. That's the middle graph here in the slide. That's a super important part of my work. And perhaps my main project, which is in red here, it's a pilot RCT that is dismantling yoga, and I'm taking the stretching posture, which are called asanas, to evaluate systemic inflammatory mediators after an acute intervention. Finally, I'm also working in a systematic review summarizing animal studies using stretching and inflammatory mediators, because, I mean, this is really important. First of all, because animal studies don't get systematic review. And on the other hand, I'm going to be able to explore new designs, animal studies in the future to study the effect of stretching on inflammation. The next slide, please. All right, so about my hurdles to overcome. So I want to share with you all two different hurdles I experienced during my fellowship. One relates to the prejudices I observe in science against all kind of diversity. It is something that is there, and sometimes it feels heavy and troublesome. So here, resiliency comes in hand, because one must understand that the world will not change overnight. I instead prefer to spend my time thinking about what I should do to make myself stronger. For example, I'll give you an example. English is my second language, right? And I can't compare myself to a native English writer or speaker. So I work hard, getting better and better in that aspect. After 5 years being here in the United States, I feel happy with myself of my improvement. And I know that this hurdle is a lifelong lasting one that will only make me wiser. So, and also I feel that I'm honoring this beautiful language. The second one relates to translational research. I picture myself as a translational researcher. Although we know both fields, basic science and clinical science, need to be linked by something. In practice, the process of doing that is not easy. Clinical research is one of my weaknesses, and here the fellow has been really helpful. They gave me like a toolbox. For instance, I was able to be part of the MPH at Harvard's Public Health School, and also I really miss my fellow friends. We used to get together every Wednesday and in person, and I call that place like a sanctuary because it's full of wonderful people. Not only my, the rest of the fellows, but also my mentors. I think they. I feel that they really believe in you. They are patient too, and they really want you to succeed, and that is really important for someone that is an immigrant and Native American, Latino, queer man. So I think that's it's a wonderful place to be. Next slide, please. Okay, so thank you. I want to finish with this poem. The recent winner of the Nobel Prize, and it says, there was a peach in a wicker basket. There was a bowl of fruit. 50 years, such a long walk from the door to the table. Louis Gluck. Thank you.
Hello, everyone. My name is Yan Ma. I'm a third-year fellow working with Gloria and Peter. Next page, next slide. Thank you. I want to start with a brief summary of my background. I graduated from a program in integrative medicine in China, where I learned both Western medicine and traditional Chinese medicine. After I got my MD degree, I was specialized in sleep medicine for my clinical practice. For treatment, I used medicine, acupuncture, herbal medicine, but I was most interested in mind-body interventions. During my postdoc training, I started to build up my expertise in techniques that can capture nonlinear dynamics in physiological signals. I got experience on multiple studies with various signals, for example, ECG, EEG, EMG, and respiration. I found that techniques of nonlinear analysis could capture hidden information in physiological signals. And some of them, they have advantages over conventional method. So part of my research interest is to apply these techniques to investigate the efficacy and understand the mechanism of mind-body interventions. I successfully completed some projects and started to establish some publications, but most of them were secondary analysis based on existing data. I had no idea how clinical trials were designed and conducted. So I realized that a formal training is critical for me to go further. Then, thanks to my mentors who brought me into this great T32 fellowship program in integrative medicine, I feel that I've found my home base. I am fortunate to work with people who share the same interest and passion in integrative medicine. In our program, we have clinical and research curriculum, which offered me the opportunity to learn from internationally recognized experts in their respective fields. During the fellowship program, supported by my mentors, I developed my pilot RCT for a feasibility test of mind-body intervention for insomnia. In addition, the fellowship program offered us the opportunity to join the Harvard MPH degree program in clinical effectiveness so that we can formally learn basic knowledge in IP, biostatistics, and study design. Collectively, this experience helped me develop the foundation for my career to be an independent investigator in integrative medicine. Next slide, please. When I first joined the fellowship program, there were several challenges. For example, being a female researcher with culture differences, without formal training in clinical trials, I wasn't sure whether I could succeed in academia. Meanwhile, the bigger challenge was that my baby was born right before the intensive summer courses started at the School of Public Health. I am glad that I was able to make good balance between work and life. And now I'm a third-year fellow, and I think I've done pretty well, but I could do better. So some lessons that I have learned is how to make better use of the time during the fellowship. I felt that I needed to get up to speed on several things. For example, keep myself updated with recent findings in the field, identify my needs for development, make a transition towards an independent investigator, and learn from my mentors. After all, I only have 3 years in the fellowship. But then I gradually realized that it's actually more important to slow down. So I often ask myself, how can I make it better? Is this feasible? And I learned to pay attention to details in my research. I would encourage you to make good use of the resources in the Harvard community. I also think it's important to network with other fellows and colleagues and get inspired. And one of the most important points is to learn from the mentors. By that, I don't mean just for research, but also how they develop good ideas, how they give talks, how they respond to challenging questions, and how they inspire people. Also how they support young researchers. And time flies. Now I've done 2/3 of my fellowship, and I appreciate all that I have learned. Thank you.
Hi everyone. My name is Mike Datko. I'm a first-year fellow in the fellowship program, and I'm going to tell you a little bit about my background and basically what I think is some good advice that has helped me along the way. So I've been interested in integrative medicine because of a personal background in meditation, which started with my parents. So I kind of grew up thinking about that kind of thing, but because I've been thinking about it for so long, I had a lot of questions about it. And so that probably is what drove me to want to study it. And I had an interest in neuroscience from a long time ago as well. So those interests kind of fused. So part of my story and what has made me the kind of scientist I am now is because I started with like more of a lower level approach, like a molecular, cellular, and pharmacological approach in my interest in the brain. And my undergrad degree was basically in neuroscience and pharmacology, and I studied. I was in a lab that used a mouse model to study addiction, in psychostimulant addiction in particular. And so I have that background, but I always knew that I kind of wanted to go back and use use my interest in neuroscience to study study how I felt when I was meditating, basically. So it was kind of a long route to come back to that. After starting with work in pharmacology. So at UCSD, where I did my PhD program, I actually, my advisor was interested in studying meditation and integrative medicine, but basically in grad school, I ended up going with what was financially supported, and that kind of shaped my grad school experience. And I mean, UCSD is a great environment for neuroscience research, but at the time that I was there, they didn't have quite the internal support for integrative medicine approaches and doing meditation research. And my advisor struggled with that as well. And so we I actually did my research on functional and structural brain connectivity in autism spectrum disorders, and that was able to. I was able to learn a lot about human cognitive neuroscience and developmental neuroscience as a result of that, and I can apply all of those skills to what I do today, which is basically I'm using primarily functional MRI to study different people with different conditions, also in some cases healthy individuals as they learn to meditate. And I study mechanisms of the behavioral changes that are produced, the neural mechanisms of behavioral changes that are produced by mindfulness-based interventions. And I've done that in people who are trying to quit smoking. I did that at UMass with Judd Brewer and Amy James, who's at McLean, and then I studied. I'm currently studying mindfulness-based interventions for people with anxiety and depression, as well as people with chronic migraine. Next slide, please. So yeah, it was, as you can see, I've jumped around a bit, and I've always probably the first big jump was going from pharmacology to human developmental and cognitive neuroscience, and so that required a whole new set of skills and a whole new set of just what literature I was familiar with, etc. But then I could have kept going in that direction, but I really made the conscious choice to look for something which was what I really wanted to do, which was go back to integrative medicine. So that took some amount of risk, because I probably could have continued to be supported in doing the research on autism that I was a part of, and that was very interesting research, and it's still ongoing. I still follow up with it, but I'm really glad that I made yet another jump to really pursue what I wanted to do. And part of what allowed me to do that was just finding people and finding institutions where that was more supported. So it's really supported here, just everywhere, basically in the Boston community, and particularly in the groups that I'm working with, and of course this fellowship. So that would be one of my main pieces of advice to someone who, if you're a grad student or you're going to be, or you're looking for a postdoc position, anything like that, don't just look for the specific lab that you want to do work in, or the specific project that you want to work on. I would really seek out places that have a larger supportive environment for the kind of work you want to do, because that is what will really allow you to flourish and to do what you want to do, and explore new opportunities, make connections. And I think that's it. Thank you.
Hi, everyone. My name is Kristen Kraemer. I'm one of the fellows based at Beth Israel Deaconess Medical Center. So next slide, please. So just a little bit about my background. My training is in clinical psychology and health psychology specifically. In graduate school, my research really focused on studying the cognitive and emotional factors that impact health behavior change. And after graduate school, I really wanted to apply this foundational knowledge and gain experience with mind-body clinical trials to study mind-body interventions for health behavior change. And I think integrative medicine dovetails really nicely with clinical psychology, given its focus on the whole person, the mind-body connection, and really the importance of kind of the biopsychosocial approach. So to me, it really made sense to join the Integrative Medicine Fellowship, to continue studying health behaviors. And so throughout my career, I had focused on things like smoking cessation, eating behaviors, physical activity. And on fellowship, I've really aimed to gain more experience studying mind-body interventions for promoting these types of healthy behaviors. And ultimately, I hope to optimize, down the road, optimize mind-body interventions for successful health behavior change. So next slide, please. And so despite the nice fit between integrative medicine and clinical psychology, on fellowship, I found myself in a department with no psychologist at all. And so I'm in the general medicine department at BIDMC, which is mostly made up of internal medicine physicians. And being in a department where, I was the only psychologist, where people weren't at all familiar with my background training, my area of research, I think it was challenging at first, but I do think I learned some important lessons, which fall nicely into this theme of kind of finding the gap, which I'll explain in just a moment. I do think some of this applies more broadly to integrative medicine researchers and clinicians, because oftentimes we're the only ones, or there are only a few of us in our department with our type of background and training. So in transitioning and adapting to this new environment, first I learned the importance of identifying a research gap in the department, and then really connecting that with how the research that I will do to fill that gap complements the existing research in the department. Really with the goal of generating enthusiasm or interest around my work among the faculty, and finding potential collaborations with others in the department. And so for me in the general medicine department, the physicians were doing research around heart disease, cancer screening, and so on. And all of these areas in some way or another rely on or focus on behavior change. And so I found that I could bring my expertise in behavior change to kind of complement some of this research, and then obviously conduct my own line of research in this area and demonstrate that the research that I was doing brings value to the department. Second, I came to understand that, as you all know, people in different disciplines tend to speak very different languages. And so, I learned to speak the language of the physicians in the department so that I could essentially effectively communicate my research, my value to the department, and again, really to drum up support for the work that I was doing. And then finally, I learned, the importance of actively seeking out other needs or opportunities in the department where my area of expertise could be helpful. And so for me, that meant seeking out opportunities that weren't immediately obvious or available. And so in my situation, my mentor and I identified a need in the primary care clinics at BIDMC. So there hadn't been any psychologists in those clinics at BIDMC. And so I'm planning to do some work in the primary care clinics in the department to use my area of expertise in health behavior change to help patients in those areas. And so in sum, as someone who didn't fit the traditional background of the faculty in my department, I learned to, again, identify the gaps where my area of expertise could be valuable, learn to speak the language of the department to generate an understanding and enthusiasm for my work, and then learn to proactively seek out other departmental opportunities. So thank you so much.
think we have one more, actually.
Thank you. Hi, everyone. My name is Amy Young, and I'm a second-year fellow in the fellowship. Next, please. Next slide. A little bit about me. I'm Korean American. My family immigrated to the US from Korea when I was around 10 years old. And since then, I grew up in the States, mostly in Northern Virginia. Then for college, I came to Boston to study biology at MIT. I then pursued a master's in acupuncture and oriental medicine at Virginia University of Oriental Medicine and a master's in complementary and alternative medicine at Georgetown University. I then completed a doctoral training in acupuncture at Nanjing University of Chinese Medicine in China. And then I joined this fellowship here at Harvard just last summer. My research interests and projects right now, as you can imagine, are focused on acupuncture. Specifically, I'm interested in studying the impact of acupuncture for cancer-related symptoms and exploring whether there's a biological basis for acupuncture points. Next. In reflecting on my experiences, one of the biggest lessons that I've learned is developing a personal vision. Next, please. I found that without a vision or a sense of direction, it's really easy to feel lost, overwhelmed, and stressed by the sense of being pulled in so many different directions. Next, please. The time in my life when I felt the greatest need to develop a personal vision was when I was deciding on whether or not to go to China for a doctoral study in acupuncture. By this point in my life, I've already gone through years of schooling through my bachelor and master's program, and I felt that it was really about time for me to begin my career as an acupuncturist in the US. At the same time, I was also beginning to have some doubt or wondering whether I've chosen the right path in the first place to become an acupuncturist. I felt this way because in the US, there's really limited infrastructure or system in place for acupuncturists to build their career and gain financial security and so forth. And so there were moments when I wonder whether I should be exploring other career paths in lieu of or in addition to acupuncture. So I felt somewhat lost and I didn't know what my next steps would be. Next, please. To overcome this, I've learned that it's important to not only look ahead, but to look back on your past experiences, your education, your interests, values, and strengths. And in the process of writing these down and reflecting on them, I recognized that I was deeply interested in both basic science and research on one hand, and the practice of acupuncture and oriental medicine on the other. I didn't know quite how, but I wanted to somehow bridge or integrate these two areas of interest. Next, please. And so this sort of became my personal and professional vision. But even with this vision in mind, it was still hard to make and commit to a decision. And I found it really helpful to just take a step back to see myself in the third person. And this allowed me to see that the person pulling the strings or pulling me in different direction was none other than myself. And this gave me a sense of empowerment or control over my decisions. And through this process, I came to a decision that going to China for a doctoral training in acupuncture most closely aligned with my vision. Next, please. And this sense of direction then allowed me to focus on finding other opportunities that align with my vision, which then led me to this T32 fellowship here at Harvard. And through this fellowship, I've learned that it's important to continually identify and hone skills that are important for achieving my vision. And one such skill has been interprofessional communication. I realized that I need to learn to communicate to diverse audiences, ranging from other acupuncturists to basic researchers to other clinicians and caretakers. And so has been an important skill that I need to learn, and I think it's an important skill for anyone interested in the field of integrative medicine. Last but not least, I think it's important to stay focused, but also flexible. Life is very unpredictable, and there may be significant changes in our lives and the context in which we make our decisions. And I think it's really important for us to take time to acknowledge these changes and perhaps reevaluate our priorities and make adjustment to our personal vision. Preparing the slide has been really helpful for me to reflect on my own journey. And I hope that the lessons that I've learned and shared resonated with some of you and were helpful in some ways. Thank you.
Well, thank you. Thank you each for sharing a little bit about yourself. You really are an incredible group of people, you know that, with passion, with vision, and such breadth actually across all of your work. So I appreciate you sharing your story, you know, as an early investigator in the field of integrative medicine, as an individual, you know, navigating a sometimes stressful environment, you know, navigating the interprofessional communication, issues of diversity, finding, you know, your path. You've stated some real challenges and how you've faced these, and I appreciate all of your honesty there. And then also in retrospect, it's been really nice to hear what your important lessons learned, you know, are. So so I'm just looking here. It doesn't look like we have any questions yet from our audience, but I think I can get started in terms of thinking about all that you've talked about. You know, and those in our audience, if you'd like to ask a question, you know, to one or all of the panelists, feel free to do so in the QA section. Otherwise, I'll just be using my moderator's prerogative to ask some questions here. So I'm going to start with an easy question, and I think it's an easy question. So, so for each of you, so what are the top kind of one or two ways that you know you use to de-stress and, you know, address resiliency in this often demanding academic environment?
I'll start.
Yeah.
Since I touched on that in my presentation. I have a dog, so I feel like she is my go-to story and source of self-care always. But more specifically, I think it creates an opportunity to get outside. I try to make sure I never take my phone with me when I'm walking outside, so that really is kind of my informal mindfulness practice, if you will. And just in general, having another you know, living creature rely on you really means you have to create kind of some space and make that a priority. So she's certainly one. But then definitely my family, my husband, my friends, relying on them when I can. I think sometimes the hardest part is the work I do as a clinical psychologist is confidential. So I can't always be sharing challenges at work. But when there are ways for them to support me, you know, I let them, and then I have my work colleagues to help fill in the gaps with the rest of it.
A little bit of pet therapy, a little bit of nature therapy, and then family is always great. Yeah.
Perfectly summarized.
Anyone else?
I can go. I could just say quickly. I think for me, it's setting work-life boundaries, but then the key is to stick to them, even if there are things to be done, because there will always be work to be done. And then outside of that, for de-stressing, I usually try to purposefully plan like one kind of enjoyable activity that I'm going to definitely do on the weekends. So things like exploring a new town or trying a new restaurant or something like that. So I find that really helps for de-stressing over the weekend.
I'll just share one more thing. For me, I think plugging from computer, turning off my phone, and just setting aside time for myself, I think, and devoting time for creative outlet. And so I like to do arts and crafts. So I like to work with my hands and find ways to express myself in a more artistic, creative way so that I'm using not only my left side, but also right side of my brain.
Now that you've exposed that, Amy, I'm going to want to see some of your artwork. Yeah, I think especially during COVID, right? I think we're all on the computer, Zoom or whatever. And so I think break from technology is definitely one way. Others?
I can go. So for me, it's very simple. I just love to spend time with my family. So sometimes I feel stressful. I just put work away and go downstairs and play with the kids. I enjoy laughing with them about silly things, and maybe take a walk with my husband or just cook in the kitchen. So just allow me some personal time away from work. I think that is very helpful to me.
Yeah, I also enjoy having creative outlets, sometimes multiple creative outlets. So especially during when there wasn't as many places that we could go at many times in the past year because of the lockdown, I found that photography was really a fun thing to do because you have to well, you can do it inside, but I was doing outdoor photography, but you don't have to go anywhere, and it's actually kind of a mindful activity. You're just there, and it's all about just observing and putting yourself in a very observational mood and finding the frames that you like. So that's been a really nice outlet for me. Yeah.
Nice.
Okay. Pretty similar to all of my fellow friends here. I enjoy time with my family, but on top of that, I try to respect my yoga practice. That doesn't mean that I do an hour and a half every day, not at all. But sometimes I just want to be on my mat 5-10 minutes and practicing some posture to get better. And also, maybe you don't know this, but I write and I read a lot of poetry, and I work with this editorial in Chile. They send me poems and I review them, and we publish works and things like that. I think poetry and just writing is an amazing way to take all that burden that this modern world put on our back. And yeah, it's a channel. It's a way for me to release that tension. Yeah, thank you.
Very nice, very nice. So I'm actually looking, there are a couple of questions in the chat here. So so one is actually asking, so as fellows with very diverse backgrounds, each of you, someone asks, how helpful has it been to actually learn from each other, and whether each other have influenced, your own research ideas or trajectories? I think that's a nice question. What do you guys think about that? I mean, I can give my answer. Of what I've seen. Actually, it's just been wonderful for all the different perspectives to come together. At our Wednesday conferences, and each of you lend a different expertise to whatever subject we're talking about. Some of you are the experts in that particular area. Others are the learners during those sessions, and so it's just very rich. And I think always learning from a different perspective is, I think that's one of the themes that's come out, I think, today, not just from our session, but from earlier today, of what each individual kind of brings to the table. Yeah, well, let me step back and hear your thoughts on that a little bit.
So, I mean, I could say my experience that I had with Ivy when we were doing the MPH, I really feel that we support each other during those, all those classes that we took. And and it was really interesting to get to know Ivy in a very intimate way. So yeah, and I learned a lot about her work. So yeah.
Yeah,
Oh, go ahead.
Okay.
Amy, go ahead.
Okay. I just wanted to point out that prior to coming to the fellowship, I knew about mindfulness meditation, but I didn't know all the details. So Kristen's presentation on our Wednesday's meetings, it was really helpful. And I'm hoping to also continue to learn from Kristen, but also from Jacklyn on more about meditation.
I was going to echo something similarly, which is the idea of investigating cardiovascular health outcomes is very new to me, and I often get encouragement to think about how to measure more biological or physiological outcomes, and I think I find that very intimidating. But as soon as I joined our weekly seminar and started to hear that other people were already doing that work, I immediately got more comfortable and thinking oh, I can do that because I already have this built-in network of experts that are gonna, I hope and know, will help me kind of navigate that and learn that new skill. And I think otherwise, I might have been a little bit hesitant to kind of, restart and kind of reformulate what my area of specialization would be.
Yeah, I agree with that. I mean, I am also new in this fellowship, and at least I think at least half of us have worked with heart rate variability data or some similar data, or will be, and so it's really cool to have that support. Even though I haven't had extensive conversations with people about that yet, I'm also going to be collecting that, and so really looking forward to kind of comparing notes and approaches, and yeah, it's really cool. And it's amazing how that kind of data and some other kinds of data are used by studies of. It's useful for neuroscience studies. It's useful for clinical behavioral studies. It's just so it's great that we can all talk about the same thing.
Yeah, I can just quickly echo what everyone else has said, which is that because there's so much diversity in terms of our background and training, just hearing the different presentations from other fellows, I've learned so much, especially about physiology and inflammation, and I think that's really beneficially informed my research to a great degree, and I've actually put some of that in my K application, and so I credit the fellows for really informing me on those different topics.
I also learned a lot from each of the fellows. I'll just make a simple example. So I used to be, I was trained in acupuncture several years ago, but now since I know Amy, I heard a lot of her perspective from someone who was trained in biology. There's always new ideas or new direction of thinking about things. So that is also a learning curve for me. And also right now I'm doing research on brain dynamics. So I look forward to learn from Michael, and I'm using mindfulness, so learn from Kristen and Jackie. So I think this is a good team.
All right, we have a few more minutes. I'm looking at some of the questions. So let me ask this one. So and I think some of this, Jackie, you spoke to during your presentation, but as you progress in your integrative medicine research career, you'll need to and you'll want to develop collaborations with many other disciplines, cardiology, sleep medicine, or completely outside of the field of integrative medicine. How do you approach these collaborations with those who aren't familiar with integrative medicine?
Often.
Yeah.
I think the one piece of advice I have, because I'm pretty new in this, right, as a first-year fellow, but I think one piece of advice I've gotten, or one way that I've been successful at this in working on a grant application right now, is leveraging the network that's already there. I think we're all fortunate to be tied into the Harvard medical system and what other systems people who are listening to this presentation are linked up into. I think there's a chance that you know someone who knows someone who possibly knows someone who's interested in similar things or has that area of expertise that you're looking for. And so I always try to leverage like the connections and the mentorship I have now, and then in a kind of second degree way, then build new relationships and constantly emailing people, sending them my work, asking them for a meeting. And I think that's been helpful so far.
Okay.
I can go.
Go ahead. Yeah.
Yes, I just wanted to, maybe this is another perspective. So I would consider myself a very, very slow learner in developing collaborations. But once I get to know someone, I really commit with that person to develop, a research idea. And right now I'm taking this program that Amy introduced us last year, the Impact from MIT. And it has been really helpful because, yeah, it's part of me that I could be 2-3 days without speaking to anyone and just working on my research, and that's not good. I mean, I need to be more, not that shy, and just get there and talk to people. And the Impact program from MIT is helping me in that, how to present my idea, how to engage people in the type of research that I'm doing. So yeah, I hope to get better.
I'm going to actually shift real quick because we only have a couple minutes left, and I want to get this something in here into this discussion, and not everybody needs to answer, but so many of you have mentioned, cultural differences in some way or another, right? Whether it's coming from a different culture with respect to race, ethnicity, or your training, or a different health discipline, or your what have you found helpful, or what do you think could be helpful to better bridge mutual understanding, across these diverse people? Any thoughts on that? It's a big question, I know. I mean, part of it is, learning how to speak the other person's language, and sorry, go ahead. Was somebody going to say something?
I can tell you what I think. So I think it would be very important for everyone to know the prejudice that we have inside. And sometimes if nobody's telling you that, then it's really hard to know those things that you might need to change a little bit. But when you're in a diverse environment, that it becomes easier. So I think this group is super diverse. So I have to rethink if I'm going to say something. I go like, okay, this is how I would say it in the Latino Chilean way, but I'm here, so maybe that's not the right way to say it. And yeah, so that's like a constant exercise that I do in my mind, because I don't want to hurt anyone in terms of feelings and things like that. Yeah.
It sounds like bringing in some of that mindful awareness into all these interactions. So thank you all.